A deadly virus is moving towards rebel-held territory in eastern Congo, and the outbreak is becoming more than a public health emergency. As Ebola spreads, the battle is no longer just over land, but over who can protect the people living on it. In Congo, the next fight for power may be decided by a virus. Deep in the forests of eastern Congo, a virus outbreak identified far too late is now racing towards territory where the government holds no authority at all. The World Health Organization first detected the outbreak in May, and health officials warn it could become the worst in history. Congo's health ministry reported 1,561 confirmed cases and 506 deaths as of July 5th, with the epicenter in Ituri province now edging closer to areas held by M23, the rebel group that seized swathes of the east last year. One infection has already surfaced in Goma, the rebel stronghold and provincial capital, though transmission there remains low for now. For M23, the outbreak presents a strange kind of opportunity. Officials fear that if the virus explodes in rebel-held territory, it could devastate civilians already trapped by conflict. Yet, if the rebels manage to contain it, they could strengthen their claim to legitimacy at a moment when Kinshasa is struggling to get the response under control. The distrust runs deep. Isolation wards in Ituri have been burned, medical workers attacked, and many locals dismiss the virus as a hoax invented to enrich officials. Memories still roar from the 2018 outbreak when misused funds landed the health minister in prison. Congo's government insists neither M23 nor its backer Rwanda can manage a crisis this size.
Both the M23 and Rwanda are ill-equipped to run an emergency response for a threat of this magnitude.
Wagner insists Rwanda must withdraw entirely for health workers to gain unfettered access. Rwanda, which has stationed between 14,000 and 18,000 troops in Congo, according to a UN panel of experts, says it is accelerating withdrawal under a peace deal brokered in Washington last year, having partially reopened borders shut back in May. Verification remains the real obstacle. Congolese officials admit they cannot independently confirm case numbers, deaths, or contact tracing coming out of rebel-held areas. With two key airports still shut by the rebels and humanitarian corridors blocked, aid agencies say the coming weeks will decide whether this outbreak stays contained or spreads into some of the most densely populated, hardest-to-reach corners of Congo. For now, the virus and the war are advancing on the same map, and neither side controlling that ground seems fully prepared for what comes next. The Democratic Republic of the Congo is facing a rapidly worsening Ebola outbreak, with health officials warning that the whereabouts of nearly 300 people who tested positive for the virus are unknown. Africa's top public health official says the missing patients raise fears of widespread, uncontrolled community transmission. More than 1,100 confirmed infections have already been recorded, with over 300 deaths, making this the largest outbreak ever caused by the Bundibugyo strain of Ebola. Health authorities believe the real scale could be far worse. According to modeling by the World Health Organization's Africa Regional Office, the outbreak could reach around 8,200 confirmed cases and more than 1,400 deaths by mid-September under the central projection. In a worst-case scenario, infections could exceed 66,000.
30% of new cases are among known contacts of confirmed cases. This indicates huge community transmission. Bed occupancy in Ebola treatment centers is at 95%, and we haven't reached the peak yet.
The missing patients are only part of the problem. More than 1 million displaced people are living in camps to which health workers have no access whatsoever. Contact tracing is impossible there. The scale of transmission inside those camps is entirely unknown.
We cannot have a photo of what's happening there. We cannot stop this outbreak without resolving the humanitarian issue.
Officials say roughly 30% of new infections are already emerging among known contacts of confirmed patients, a sign that transmission is accelerating inside communities. Treatment centres are also nearing capacity. Bed occupancy has reached 95%, even before health authorities believe the outbreak has peaked. The crisis is no longer confined to Congo. Neighbouring Uganda has reported infections, while France confirmed that a doctor who recently returned from the DRC has tested positive after working with patients there. WHO modelling suggests there is also a 70% probability that the virus could spread into South Sudan in the coming weeks. To contain the outbreak, Congolese authorities have introduced a 21-day waiting period for anyone leaving affected provinces before they can continue travelling. Africa CDC says the overall humanitarian and health response now requires around $1.4 billion, but only 13% of pledged international funding has actually been delivered. There is, however, one sign of hope. Clinical trials of the first experimental treatments specifically targeting the Bundibugyo strain are expected to begin in Congo within days, alongside preventive antiviral trials aimed at protecting people exposed to the virus. For now, though, the biggest mystery remains unanswered. Nearly 300 confirmed Ebola patients are missing. And until health workers find them, officials warn the outbreak could continue spreading silently through communities already devastated by conflict.
Tout à l'heure, quand vous avez constaté, les gens viennent de Zaïre, c'est-à-dire pas Zaïre mais Congo. Donc ils viennent du Congo. Quand ils arrivent au niveau de la République centrafricaine, ils doivent passer au dispositif de lave-mains. Une fois lavé les mains, on doit les enregistrer, flasher d'abord premièrement, et on doit les enregistrer. C'est-à-dire que ça commence par les numéros, donc c'est numéroté. Donc de 1 en descendant. Et premièrement, on doit prendre leur affiliation. Donc nom, prénom, âge, sexe, provenance, destination. Et la température, si possible, même le numéro de téléphone. Et c'est ce qu'on a l'habitude de faire. Si la température s'élève au-delà, c'est-à-dire au-dessus de 38 et d'une manière répétitive, on doit faire une alerte au district sanitaire. Mais si la température est au-dessous de 38, alors donc ceux-là, on doit les libérer. Ils passent par l'immigration pour faire la formalité et sortir.
Si on teste comme ça, c'est bon, parce que là, au Congo, il y a virus, mais ici, il n'y en a pas. Avant de traverser, il faut faire ça pour éviter les dangers. Oui, c'est une bonne chose pour le gouvernement central. Il faut faire ça. Si on ne fait pas ça, les Congolais viendront contaminer les gens ici à Centrafrique, ça ne sera pas bon. Il faut éviter, il faut préparer à partir de ce moment-là. Là, ça sera bon pour le gouvernement centrafricain.
Bon, bêta, d'accord, parce que moi, j'ai maladie Ebola, ça que je n'avais pas. Si tu es à ça, à ce quoi faire. Il laisse et battre ton âme, n'a pas que tu Congo, n'a pas que tu es. Et il a tenu ça, bêta, parce que il y a des voisins là. tongala ala wagala kaso ke wagaike mingi kweke kwinga legako na ala nila se ba emu merci mingi na ministre de santé ça si atokwa zoge agake examiner zona si ina ke dialoguer si va kumba mboko tala na tiso si kobela la gaso kungana katiko jona encore après kungana ga kete esi ke wa ngai kete ke voni
chimbi akenzoni ape iba so iduchige kango yiti ige so iduchi na ita so proche mbeto akeda tene ti kwale ti kobela so ayeke na mbege tingu nila mbiba azo so ngorobi azala ge ti sara kwa ti bando na ndo kwale ti kobela so ge na aita ti so ke na mbege tingu mbiba la sara kwa pendre asara si kobela so ape ti lindande na secteur ti igi ape do be ti mbia si na kotangya na azo so lo zala na sarango kwage